Hello, this is Dr. Stanley Lang, and the subject of today's broadcast is my leg pain Lyme disease? The reason I wanted to talk about this is because of three different patients that I saw today that might have Lyme disease. And one of them presented with a simple, uh, fairly simple set of symptoms, which is just his legs were aching from his hips to his knees. He hadn't done anything different. He'd been doing exactly the same routine for over a year at least. He felt excellently otherwise. He was just having this kind of pain, which limited his activity when he would get the pain. He definitely didn't have the kind of symptoms that are typical of degenerative joint disease, the typical aging arthritis. And even though he's in his 70s, he was a very vigorous, active person, usually till these symptoms started. I told him he probably did have Lyme disease. And the reasons that I told him that is that his set of symptoms did not match any of the usual medical conditions. Now, we went ahead and got some x-rays to make sure that he didn't have an accelerated arthritic process going on in his joints, but that was just to be on the safe side. But his best option is a trial of antibiotic therapy. If he gets better with 3 weeks of treatment, if he gets some improvement in 3 weeks of treatment, he probably has Lyme disease. I don't recommend Lyme testing in this case because the test is more often negative than not when people actually do have Lyme disease. So it doesn't help me to make a decision. Now, the second person that I saw had a classical presentation for acute Lyme disease and had this photograph that he'd taken of a bullseye rash that he'd had that was just last week. And he was started on antibiotics, and within 3 days, his pains were a lot better. Now, in his case, he presented with the worst kind of flu-like symptoms that you could imagine. Very, very sick, in bed, almost delirious, but yet within a couple of days of, actually almost the first day of antibiotic therapy, he was already starting to feel better. And almost 5 days later, he's feeling quite a bit better. So he almost certainly has Lyme disease. There's very little doubt that he has Lyme disease with that kind of a bullseye rash, which is usually not present in most people with acute Lyme disease, but when it is present, there's a high chance that they have it. The third patient, much more difficult case, has had this typical arthritic process going on, wear and tear arthritis, osteoarthritis, actually has x-ray changes that are consistent with it. But she's got some strange symptoms. She's got these sensations of burning here and there throughout her body that just don't fit. She's got pains on the bottom of her feet that aren't typical of degenerative joint disease or osteoarthritis. So I offered this patient a trial of treatment, and the patient is considering whether to do that at this point. There's a couple of other options that we also reviewed when we're not sure is it Lyme disease or not. So when you have strange pains that don't make sense clinically with other conditions, the chances are pretty good that it could be Lyme disease, good enough that a trial of treatment is something to consider. Now, one of the problems that a lot of people have is that they don't have access to somebody who can prescribe antibiotics or is willing to prescribe antibiotics when the diagnosis is not certain. Most doctors in the United States are still plugged into the old system of only treating if the test is positive. Well, the test is negative most of the time. And so a lot of people are wandering around out there without any treatment options. So that's one of the reasons why I created the Natural Lyme Disease Treatment Program. Now, there's a lot of different things that you can see on the internet and on YouTube, all these variety of so-called natural treatments. The reason that I recommend that you consider this treatment is that it works quickly if it's going to work. Within a month, you'll know that you're feeling better or not. And it's totally non-toxic, and it's based on good science. So if you're interested in trying to decide, are my symptoms Lyme disease or not, get the program and see whether or not you respond to the strategies. If you do, the chances are pretty good you're dealing with Lyme disease, just as I mentioned in some of these other cases, because we currently, in the United States, have no tests that are even accurate half of the time for Lyme disease. So we don't have a way that's foolproof to diagnose you with a test. So when it might be Lyme disease, the only way you know is to try to treat it. Well, if there's some reason that, and there are many reasons why not to use antibiotics, if there's some reason not to, using this natural strategy, totally safe, totally non-toxic. So hope you found this information helpful. God bless and have a great day.